nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Thank you. At this time, we need a motion to approve consent item. Mr. Peterson made the motion. Mr. Dallas seconded it. All in favor, aye. Opposed, no. Motion carries. Now, we have a public hearing regarding the Bladen County Home Health Care. We had it last time we met, we approved to sell it. And there's open now for anyone that would like to make comments about selling their home health care. Anybody want to come forward, or any commissioner would like to say something about it? Nobody has anything to say, we declare the hearing closed. David Howard, Mr. Howard here?
Yeah.
David, you have a introduction, Kelly Robinson, right?
Yeah.
Okay, you take care of that for us, please.
So this is Kelly Robinson, our new aging director. She's, I'll just have a few comments and then she can tell a little bit more about herself. She's a lifelong resident of Bladen County. She lives in the Tar Heel area with her husband and 9-year-old son, Peyton. She attended Southeastern Community College for ADN and nursing, and also UNC Pembroke for DSN and MSN, and received her Certified Nursing Leader certification there as well. Her leadership training is an advanced degree preparing leaders to integrate teams and to facilitate, coordinate, and oversee operations on both the small scale and the organizational scale. She has already shown her positive dedication to our seniors, our staff, and our community, and we're happy to have her on board.
It's very nice to meet you all. I've spoken with some of you, and I just look forward to helping our seniors in the county age in place, per se. If there's anything that any of you need for your constituents, please don't hesitate to give me a call.
Thank you.
Thank you. I think you have something else, don't you?
Yep.
Okay.
Amy D'Angelo, our WIC director, is going to let you know about the award the staff received.
Okay. You got the floor. D'Angelo. Are the recipients here?
Half of them are. The other half's in the training. This is Tawana Lewis, and she has been at WIC, Women, Infants, and Children, for 15 years now. And her other half, Cassandra McKinley, who's been with the WIC program for 21 years, was nominated and was presented the award at our state conference for Staff Member of the Year for the entire state. I'm very proud of the work that they do.
You want to see the award?
It says WIC Staff Member of the Year, Tawana McDonald and Cassandra McKinley, Bladen County Health Department.
All right.
Is Stacy Kim off there? Stacy Kim off? We got an award to give you.
Just for all the 4-Hers? Okay, so
What-
I would
whatever
like
you
all
want.
of our
Anything you
4-Hers to come up here and gather right here in front of these county commissioners. I want mine. This is our county council president, and this is Aaliyah.
Let all the little to get up front, some of them did back here.
Alright, come to your call.
One in the middle.
There you go.
There we go.
Now see this guy?
Yeah, good.
I'm gonna let you present it to our president, if that's okay. She's right here.
All right, we have a proclamation, and it's a Forest Development National Award. This group received it, and we're very proud of y'all too. And we have, the proclamation, I'm gonna read it, and we're gonna present it to you. Whereas 4-H youth across the nation are leading efforts to solve problems in their communities and make a difference for their futures. And whereas 4-H is the largest youth development organization in North Carolina, and the largest in the nation with 6 million young people. And whereas 4-H in North Carolina claims over 240,000 youth members and 21,000 volunteers, while Bladen County's 4-H program impacts more than 1,000 youth and more than 100 volunteers. And whereas 4-H is part of the North Carolina Cooperative Extension Service of North Carolina State University and North Carolina A&T University, is a program where young learn through opportunities that provide them hands-on experiences in 4-H's mission and mandates of science, engineering, and technology, healthy living, and citizenship. And whereas 4-H has connected youth and their communities with the innovative research and resources from our nation's 106 land-grant universities and colleges for more than 104 years. And now, therefore, the Bladen County Board of Commissioners does hereby proclaim October 2 through 8, 2016 as National 4-H Week in Bladen County, and urges the people of this community to take advantage of the opportunity to become more aware of the special program that enhances our young people's interest in their futures as part of Bladen County 4-H youth development, and to join us in recognizing the unique partnerships between our county and our state university system, adopted this 3rd day of October 2016. Thank you. Thank you. Thank you. I'm very grateful.
I think we do continue to get good citizenship. You all can have an impact on others by being good citizens yourself. So continue to demonstrate good citizenship, and that'll make Bladen County a better citizen. We appreciate all that you do.
Well, we appreciate you all too. And Mr. Chairman, I do have, one of our youth had an assignment that she had to make an address to the county commissioners after attending the youth summit for the state association of county commissioners. So I'm going to give Alea the floor for just a minute and let her tell you guys some Bladen County 4-H updates. Is that okay?
Yep, great.
Okay.
Great. Thank you for coming. Whenever you're ready.
Well, I'm a representative as a 4-H delegate of the NC Association of County Commissioners annual youth summit event, where I met one of the county commissioners, and we did icebreaker games, and we found out how important and stressful being a county commissioner is, which I pay much respect. In celebration of the National 4-H Week, on behalf of the volunteers and the 4-Hers and the program staff and supporters, we would like to thank the county commissioners for your continued support and dedication to the 4-H development in Bladen County. Our 4-H program is continually growing and expanding. We currently have 4-H clubs in E-Town, Ammon, Harvest Creek, East Arcadia, and Tar Heel communities, with the plans to extend to Bladenboro and Carson in 2017. A majority of our overall 4-H program impacts youth across the country, not just enrolled in clubs, as we partner with schools, after-school programs, and other community organizations throughout the year. Last year alone, we documented the impact of over 1,500 of our Bladen County's youth ages 15 to 18. 4-H is the nation's most leading youth development organization, committed to building outstanding leaders with skills to succeed in today's global society. North Carolina's 4-H program focuses on improving lives of youth and their communities by offering opportunities with to learn by doing in areas of eating healthy and physical activity. Also, we did programs over the summer with the robotics and drone discovery. I'm also a member of the Down East 4-H group that meets at Tabernacle Holiness Church every month. We did we built airplanes, and we also programmed actual robot. And
You did great.
Let's give her a hand.
Miss Erin wants to get one more picture, I
Okay.
think, if that's okay. Y'all look everybody look at her. I'm not in the picture, but I probably, I don't know,
You
let
need
me
to
get
get in the
behind
picture.
you. Here we go.
There we go. All right, everybody look this way and say 4-H.
Great.
Good job.
All right, thank you.
Thank you. Thank you.
How you get over it? Good news. I'm gonna call you.
This time, the commissioners have one more award to give out. It's the Domestic Violence Awareness Month proclamation presentation. And for Marjorie Walker, is she here? Come up, Walker. Congratulations. Congratulations. All right, proclamations. Whereas domestic violence is more than the occasional family dispute. According to the Department of Health and Human Services, it is the single largest cause of injury to American women, affecting 6 million of all racial, cultural, and economic backgrounds. And whereas the problem of domestic violence are not confined to any group or groups of people, but cross all economic, racial, and society barriers, and supported by societal indifference. And whereas the crime of domestic violence violates an individual's privacy, dignity, security, and humanity due to systematic use of physical, emotional, sexual, psychological, and economic control and or abuse. And whereas the impact of domestic violence is wide-ranging, directly affecting women and children and society as a whole. Whereas in Bladen County during 2015-16, Families First Incorporated served 642 victims of domestic violence and provided emergency shelter to 188 women and children. Now therefore be it resolved, we the Bladen County Board of Commissioners does hereby proclaim that October 2016 is Domestic Violence Awareness Month, and in Bladen County, and call upon all citizens to join in making every home a safe home, and to support families first in working toward the elimination of personal and institutional violence against women. Adopted this third day of October 2016. Was that flash you?
We thank you for what you do,
Sure
Mr.
do.
Lewis.
Thank you.
Appreciate all that you do.
Thank you
Help
very
the
much.
citizens. Sounds like it's for women and children.
Yes.
We really appreciate that.
We do have some men that's going.
That's a man's going through.
Don't forget them.
All right.
Thank you.
They started on.
They did.
Thank you
sir.
very much. We
Thank
really
you,
appreciate
sir.
it.
part of our agenda, we have, individuals or a delegation wishing to address the county commissioners with some problems they have or some input in what we do. If anybody would like to come up at this time. Good. Now, Miss Sarah Stroud, is she present? She got she's gonna have a presentation. We asked her last time she came to let us know more about what's going on with East Point. And if you come up this time and have a seat and just tell us what you'd like to fill us in on what we don't really understand.
Excellent.
It's not your fault, it's probably us.
Thank you so much for inviting me tonight. It's an honor to be with you. I think I'm the first one to come up that hasn't received an award. I don't know what that means really. But I have a presentation tonight, and if it's too much information, you can tell me that's not what you're interested in, and we'll adjust. But I brought just some general information about East Point. As you know, East Point serves 12 counties in the southeastern part of the state, with Bladen County being one of them. And I understand that you're interested in some of the services and that kind of thing in Bladen County. So if you'll allow me, we'll run through the presentation. Please feel free to ask questions, and if I don't know answers, we'll get you answers. How about that? So three main areas I would like to talk to you about tonight. One is just kind of reviewing some of the data that I think you might be interested in. Then some of the information about where our reinvestment dollars are going, where they went last year, where they're going in the current year. So a little bit more about East Point. Right now we have just over 300 employees. And those, we have 4 different locations in actually 5, located in our 12 counties. With the closest one to Bladen, I believe, would be our Lumberton office. And this information, of course, is for the previous fiscal year, so for 16. Our budget was $325 million, and $279 million of that was made up of Medicaid. In our fund balance, we have just over $122 million, and $65.4 million of that is Medicaid. The county funding that we receive from Bladen County is $52,725, and that makes up about 3% of the total county funding that we receive. With the funding that we receive from Bladen County, we provide ADVIP services. Those are provided by a provider named Monarch, and then also Southeastern Regional Hospital in outpatient, inpatient, patient, and crisis beds. Looking at the provider network in Bladen County, as we know, Bladen County is small in terms of the number of people that we serve. We have 10 provider agencies. We have 1 licensed independent practitioner and 1 hospital. Now, those are providers that have brick and mortar establishments in the county. Also, we have providers who do community-based services, assertive community treatment team, community support team, and intensive in-home. Those providers come into the county from other counties to provide those services. We also have you're probably familiar with this, we have a rule, a 45-mile, 45-minute rule. So someone can get services within a 45-minute, 45-mile distance from their home. So folks, maybe, I guess it would be the southern end of your county, might go into Columbus County to receive services. These numbers, the total number of Medicaid eligibles that are in Bladen County for 16, just over 8,382. And of those, 1,159 actually received a service, or services. For the indigent population, and when we use that word indigent, that simply means that they do not have Medicaid at the current time. So almost 6,700 of those members, and out of those, 206 receive services. And you may be questioning why there's such a difference there, and I have a slide in a couple of minutes to address that. This pie chart represents duplicated funding sources, and you'll see the biggest blue piece of pie are the state services, and those 206 folks who receive services there. That's a unique count. They would not have received Medicaid services. But the big green piece of pie, the folks there, while they have Medicaid, they may receive Medicaid services, but there may also be services that are not provided under Medicaid, and they could have also received the state service. And then here are the claims that we paid for Bladen County in 2016. I think I'll need my glasses for these. Just over, 4.6 million for Medicaid, 342,000 for state, and 2.3 million for our Medicaid C. And when we say Medicaid B and C, that refers to the waiver that we operate under. And the services that are provided under the B waiver, those are the general services for mental health, substance abuse, those kind of services. Under the C waiver, that's where the services for developmental disabilities are served, or innovations. You may hear that name sometimes. The name of the game for managed care, for our behavioral health managed care, is to take the dollars that we are able to save through cost savings and efficiencies, and then reinvest those dollars into our community. So part of what we're doing with our reinvestment, and I tried to just target the things that would affect Bladen County, we're expanding our facility-based crisis services. That's out of Robeson County. During fiscal year 16, there were 13 Bladen County members who were served there. We're expanding from 12 beds to 16 beds. They will handle involuntary commitments, which I'm sure your law enforcement folks will be interested in. And that expansion is scheduled to be completed hopefully the end of this month, sometime in November. They had some issues once they got into the construction that slowed them down, as is often the case. We also, our success is based on the success of our providers. We deliver the services through contracts with providers now. I'm sure everyone remembers the old days when we were the area program and we provided the services ourselves. But since 2005, those have been contracted. And many of those services have not had rate increases. In particular, the services provided to the developmental disabilities population, the innovations members, we increased those rates to those providers by 7% last year. And that affected 23 providers for innovation services that served 49 Bladen County folks. And the dollar amount on that was $2.3 million just for last year. Additionally, we increased the rates for our ICF-MR services by 5%. 8 providers of those beds serving 290 people from Bladen County, just over $1.5 million. We also increased our rates to hospitals, 17 hospitals that served Bladen County folks. 151 folks and just under $200,000 in dollars. Bladen County Hospital, I understand Cape Fear operates that now, served 80 members. This is the slide that I wanted to highlight just in terms of how it demonstrates the very real difference between the services someone gets if they have Medicaid versus the services they get if they're only getting state dollars. And on this slide, the first 3 columns, you see the numbers. The red numbers are the people who need services, the blue numbers, the people who got services for Medicaid. This data actually goes back to fiscal year 2015, but if we pull it for 16, I think it's going to look very much the same. And then you see the dollars that we spent on those. Then you go over to the state side and you see the red bar represents how many people needed services, and then you see the blue bar that is way down in terms of the number of people we can actually afford to deliver services to. So that's where we really get into the gaps between Medicaid and state dollars. Any questions about that, or?
You got $120-some million in fund balance. You can't use that money for state side of it, or is that all federal money?
You know, I don't have a slide on that, and we probably should have done that. A good portion of our fund balance is either, we have to have is so much for cash, we have a risk reserve, we have, you know, all the designations out of the fund balance. And if you take all of that out, I think it comes down to around 60 million that we have. So that's where that reinvestment comes in, that we're taking dollars out of fund balance and funneling back into services.
I mean, there's such a gap there.
Well,
Anybody would, I'd love to have a $60 million fund balance.
my question is, what happened with the people that fall in the gap? What happened with those individuals?
That's right. Oftentimes they end up in emergency rooms. Sometimes they end up in state institutions. We're really, some of the reinvestment dollars that we're targeting for this year, there's a lot of efficacy for recovery-based services. We're trying, the services we provide, we're trying to do the evidence-based services that will get us the biggest bang for the buck, serve the most people, help people stay out of hospitals, and cover the widest range we can. So it's like a county. You have a certain amount of dollars to deliver the services for the county. So you try to do the things that will cover the most folks. So we're working hard to do that.
What percentage represent that covers the gap?
I'm sorry?
What percentage represent the gap?
What percentage represents
Of the
gap?
total of the people that get caught in the gap?
$22 million.
As caught in the gap?
That's the best I can see it.
Essentially, yeah.
But the thing, hospitals can't afford to take these patients. If you got $60 million fund balance that you're not spending, hospitals can't afford to take them and write it off as bad debt either. I mean, especially our hospital. Cause we're a struggling hospital.
Right, I understand.
And Southeastern's struggling a little bit, I understand.
Right. I certainly understand that.
Okay.
These next couple of slides, I just kind of wanted to talk to you about some of the activities that we're doing in Bladen County. Some you may be aware of, some may be new to you, but it really, I think, demonstrates the presence that East Point has in the county in a very general way. And I won't go into a lot of detail on these, but if you need more information, we can get that for you. A presentation for public school system, 50 staff members. We do a lot of work with anti-stigma and bullying, work around when people come from a residential facility transition, coordinating efforts with the Director of Student Services at the Bladen County Public Schools to deliver a workshop there. There were 3 schools that we received referrals for in reference to anti-bullying. Continue to meet with community stakeholders to discuss that in each of the counties. And we have an upcoming partnership with us and the public library and Bridger. I'm not sure if I'm pronouncing that right. Is that right? Bridger Memorial Library during this month, because it is National Bullying Prevention Month. We also do a number of efforts. There's a lot of gang activity in the 12 counties. We do work there, and this is through, we have a community relations person that is assigned to each of our 12 counties, and they've met with the local sheriff to discuss strategies and education, and then also the crisis intervention training. You're probably familiar with that. As I understand it, since we began this training, 25 members of law enforcement in Bladen County have been trained in this. And it helps so much in situations like we're hearing about in the news all the time now, where somebody may present with a mental illness or maybe a traumatic brain injury or some issue. And this allows the law enforcement folks to know what they're dealing with and hopefully equip them to deal with it in a way so that tragedy doesn't ensue. So I would encourage you to support that, encourage folks to participate in that. We do those trainings regularly. Then I'll just mention 3 things that we're very excited about that are already starting this year. I met your health department director as I came in. We are partnering, with each of our counties to place kiosks in the health departments. And Bladen County has already committed to do this. We're getting those in place very, very soon. And what we'll have, I should have brought a picture, but it's a kiosk. It's like a booth. And inside the booth, it affords privacy to the person. They can go into the health department. They may be having some kind of mental health, substance abuse issue, whatever. They can go into the booth. Inside there is like an iPad. And they're able to do some assessments, get an idea of what's going on with them. And then there's also going to be a phone with our 24/7, 365 days a year. And they can pick up that phone and get directly into East Point and someone who can give them further help and a referral as appropriate. So we appreciate the partnership. We're very excited about that. Part of what we will get is some really good data, so we'll know the impact that we're having on folks, and it may lead to further partnerships. We hope so, and we're excited about that. Another investment is our 10th year that we're doing the gang awareness conference in the eastern part of the state. And then the last thing is a brand awareness campaign. I think we still hear and know that people struggle to understand exactly what East Point does, especially since we used to provide the service. There's still kind of that lack of understanding between who is actually providing the service. So we're doing an awareness campaign in all of our 12 counties. I don't know if anyone has seen our newspaper ads. I think they're running in the Bladen paper, if not every week, at least every other week, to help people put a face on East Point. It'll have our phone number in the ad, as well as a link to a website where they can go and learn more about East Point. I hope that's the kind of information you are interested in tonight. I'll be glad to take questions. If I don't have answers, we'll certainly get them. And I hope this won't be the last time that I have the opportunity to come and speak with you. Thank you again for having me tonight. Yes.
Let me say thank you. Excellent presentation. But what I'm interested in is to go back to your first few slides.
Mm-hmm.
We talked about Southeastern Hospital.
Mm-hmm.
I want to know what services they provide and see if they can be provided in Bladen County and all the agencies and stuff you have. I want to know how much money is being spent in Bladen County versus Raleigh County, Columbus County, and these other surrounding counties. That's what I want to see.
So you like a county comparison?
Yeah, I want to know where the dollars are going. Because if our citizens going to Robinson for all the services, they're getting the service, but that's not. We need it here. We need the dollars to stay in our county.
I'll be happy to provide that. I don't think we'll see a lot of difference, but I'll be happy to come back.
Hopefully we don't.
I don't think we will, but I'll be more than glad to do that at a time of your choosing.
That's fine. Just whenever you get time.
Thank you, Commissioner.
Be good.
Is there a medical doctor that sees mental health patients in Bladen County?
Is there a psychiatrist?
Uh-huh.
I don't know the answer to that. I know 2 of our very large providers are located in Bladen. We have Monarch and we have RHA. Both of those are large providers across the state. And if they don't have a psychiatrist located here, I'm sure they have access to one. A lot of the providers now are doing telepsychiatry, where if I go into the office in Bladen County, if there's not a psychiatrist, and we'll find out, then they can do the telepsychiatry wherever the psychiatrist is located. And it's like FaceTime almost.
Well, a young man in my community needed to see, I call them medical doctors for the mentally ill. and they sent him over to Delco. There's not a doctor in Delco. He's going around without his medication. He's seriously ill. And I don't know where to send him. They gave him a number to call. And they told him to go to Delco. And the man is sick. He's without medication. And I want to know where's the nearest place he can see somebody that can treat him with his medicine. So where's the doctor in Bladen that can have a mentally ill person who needs his medication?
So, since...
It needs to be seen.
Right. Since privacy is an important issue...
Pardon?
Since privacy is an important issue, if I could maybe see you after the meeting and get...
What's privacy got to do with the medical doctor who can see a mentally ill person?
What I was saying is I would try to help you connect to services for this person is what I was suggesting, because I thought I understood you to say they didn't know where to call. I'm sorry if I misunderstood.
Well, I called social services, and social services gave my number to call. And I called that number. They told me to tell them to someplace in Delco. There's not a psychiatrist.
I'll get that information for
who
you.
can help.
I'll certainly
But
do
he's
my
off
best.
with his medication, came back home from Georgia. And he needs someone who's capable of writing a prescription for his medication.
Is he connected to a provider at all right now? Not at all.
It's not, I don't know where he needs to go in Bladen County. How you get your medicine? Is there a provider in Bladen County that can help a mentally ill person secure their medication?
Certainly.
I mean, who have to locate?
I'm not sure where the actual physical location is. I'm not from Bladen, but I do know Monarch and RHA both are connected to psychiatrists. So we'll help you. We'll help you.
I need to do that with everything.
I'll do anything I can to help.
Okay, thank you.
So we got 2 providers in Bladen County, you say?
There's 10 that have brick and mortar.
Is that right? Very good.
Now, I can't say that all of them have a psychiatrist, but we're going to find
But they
out.
could help with the medication.
They either can help or they can get help. We're going to take care of it.
You mentioned in your presentation there was 308 employees.
Yes, sir.
Are any of them Bladen County residents?
Yes, sir, they are.
Good.
About 3%. We have 9 employees from Bladen.
Is East and Trinity still talking about consolidating?
I'm sorry.
Is East Point and Trinity still talking about consolidating?
At this point, we certainly are having conversations about consolidation, not only with Trillium, but with other MCOs as well. You know, the Secretary's plan is for consolidation. We agree with that plan, and we're exploring options that make the best sense for our employees, our members, and our counties.
Would the county have input on that consolidation?
Absolutely. When we get, if and when we ever get down that road.
What
Do you have any thoughts for me tonight?
Yeah.
What
More providers, because the thing it means, I know once they changed to that model of providers, they used to be accessible, where we could take young people in that needed help, and you could just all over the place. Now the thing is, the most difficult thing is, like we're saying, is where to even find a provider.
That's right.
How do you get access to providers? They used to be readily available. They would be actually soliciting business. Now you don't have
Where
that.
to locate it?
Out of the 12 counties, where do you work out of?
Where do I work out? All 12 counties. My physical office, where I am sometimes, is in Beulahville, but I try to.
Well, where is the home office for the 12 counties?
The home office technically is in Beulahville. We have Beulahville, Lumberton. We just moved our office from Goldsboro to Kinston, and then we have Rocky Mount. There's a small office left in Goldsboro.
Is it too expensive to staff an office here? It's not valid. So it's not valid to put office here. We don't have enough demand for a facility.
Well, and these offices are, you know, they're administrative folks. So the administrative functions to run the MCO are, I guess, core functions might be the word I would use. So you can't duplicate those services in all the counties by any means.
Can y'all consider maybe a Monday, Tuesday, and get the rest of it, give us a couple of days?
Well, and I think, again, hopefully over time we can continue this dialogue, because I don't know that if our administrative services were in Bladen County, I don't know that that affords you anything more than what you have now. I really think where we need to focus is looking at the services we have here and looking to see how we best expand those
We
services.
just need the resources, we don't need the administration here.
I'm sorry.
We don't need the administration.
Exactly. Exactly.
You can be anywhere.
That's right.
What percent of your budget is administrative costs?
I think we're running about 8%. I've got our CFO here. Is that right? 8%.
And another point, we received state reductions last fiscal year and also this fiscal year that we are using fund balance to cover. So we did not cut any of our state services. We're continuing to pay for those out of our fund balance so that there would not be a reduction in services.
And can you please say what our cut was last year and this year, please?
It was close to 7 million last year, and this year it's close to 12 million.
And so that goes back to that fund balance that we were talking about. We're literally paying to cover those state services
Spend
out
it
of fund
down and
balance.
they're not gonna recall it.
Nope. But yet we're mandated not to cut those services.
How secure is those kiosks as far as privacy?
I think we actually worked with a group that specializes in this. So they're three-sided and they're positioned so a person would not be seen if they were in there.
Some people probably would be kind of apprehensive about going into.
They might.
Yeah,
Go ahead.
Sarah, I'll just note that in our lobby, you're right, it's not very private, so there's an office right off the lobby that we're gonna place the kiosk and leave the door open and direct people in there. That way they'll have greater privacy if they wanna use the kiosk.
Thank you.
And the system itself is pretty secure as well?
Absolutely. It's very secure because HIPAA, the privacy laws that I mentioned, that those are very important. We operate both. We all do. But the other thing we're doing is we've partnered with the health department, and as I understand it, you will have a person on site who's very familiar with the kiosk. If somebody runs into issues with it or has questions, they can tag the person from the health department for assistance.
Okay, Mr. Brown, we appreciate you coming tonight.
Thank you so
I think
much.
it's a little bit clearer than we were last time.
Please invite me back. I'd love to share information and continue this dialogue, and I'll give you a card for everything.
Thank you very much.
Thank you very much.
Thank you.
Thank you. Okay, this time, we've got Jeff Singletary of the Sheriff's Department.
You're up, Jeff.
Position he needs a vote from us on, that is well needed, and he'll explain it to you what it's about and the funding, where the funding is coming from.
Good evening, everybody.
Good evening.
I come for you tonight. We had been working on this for probably about 3 months now. The state has, I guess, increased some of the requirements on the schools, or will be in the very near future, as far as school safety, doing like lockdowns and school safety plans, and they have to be reviewed on a regular basis. What this position would be a split position, would be a full-time slot, be partially funded by the school board and partially funded from within the budget of the sheriff's office. And what we're looking to do is taking the existing part-time trainer that we have and putting in that position full-time. And basically he would go around to all the schools, talk with the principals, make sure all their safety plans are up to date, and perform at least one, if not more, system-wide drills per year, and then also perform drills at each school. On the sheriff's office side of it, I don't know if y'all have noticed, but we have increased our outreach, especially with the churches. We've got several churches now who want us to do security, help with the security plans and that sort of thing. And what this position would do would also help maintain our level of service as far as serving the churches, and also to help with the training at the sheriff's office. We have probably increased our training by 200% at the sheriff's office. I know I mentioned earlier about CIT. We're hoping to get every single officer that we have in the department trained with CIT, and then we've made requests and stuff, and we're waiting to hear back as far as getting all that up and going. So, but this position would be mainly a training position with the sheriff's office, but it would also be a school safety coordinator for the schools. the schools have already approved it on their side, provide their funding, and we've identified funding in our budget to pay for our side of it.
Motion to approve pending, that the funds leave the Board of Education, then we revisit it.
I like
Motion
that.
on the floor.
Your motion, Mr. Peterson, second, Mr. Smith.
I got a question. On the, well, I was reading the qualification of what responsibility this individual will be, and it's primarily dealing with the school system, kind of supporting the school with different things. And I know that there's been a downtick in school resource officers.
Right.
Would this person be able to support that? Because like we had a COP grant.
Certainly.
And I'm saying the school gave us the 2 COP grants, they basically coming off of those COP grants.
Right.
And they couldn't afford them.
Right.
Now they're getting ready to put money in to put the resource out. What support will he provide
The
to
thinking,
this resource?
the thinking is that he'll, you know, at least 2.5 days out of the week, he'll be in the schools, if not more, depending on how the schedule works out. But he'll be there to provide enforcement and provide security in the schools. So you're getting the safety benefit from having an additional officer or half a position in the schools.
And he'll be doing the plans with the principal.
That's right. That's right.
Yeah.
And also training the staff, talking with the staff, making sure they're up to date with all their stuff. So, right now, we really don't have anybody that, we've got one training officer, Sergeant Tate, who goes in and he tries to do all the training for sheriff's office and all the training for schools. We have Sergeant Burlington, who is part-time, and he's retired from Highway Patrol, was one of their main trainers, and we're looking at moving him from part-time to full-time to assist with that. He's been doing that, but he'll be more focused on the schools.
My question is the school looking at funding those COP grants, so they're going to turn that responsibility over to the county? Have y'all discussed that?
Have not discussed that with him. No, sir.
We have, in our school, we have a plan, lockdown plan. We have announced about an intruder.
Right.
And I know we have different colors.
Right.
The teachers, a lot of times, when we're supposed to be.
Right.
But I've noticed some things like sometimes the deadbolt locks on the inside don't work.
There's all kinds of, there's school schematic plans, there's all kinds of different things that are required by statute that we really don't know if they're being done right now. We would have a person there to ensure that all that's in place.
Mr. Senator, you ever foresee that this becoming a full expense for the county?
I have no clue. Right now, we're working with schools in partnership, and we hope to continue to.
Got a motion on the floor.
Yeah, already got Mr. Peterson made the motion. You made the second.
We had to vote.
In favor, aye.
Aye.
Opposed, no.
No.
Motion carries.
Thank you.
Secretary, thank you. We need to look at item number 7, the advisory board appointments for the October 17th meeting. Look at the pages and who's serving now that might not want to serve, and come back with us for the 17th.
Mr. Martin, we need to add the health board on there too, for the 17th.
Okay. Thank you.
Why you say not here for today?
It's not on the agenda.
No, that's called on the agenda. Because each case is a main, you know. Okay, that's, now we got Mr. Greg Marsh will come forward and give us a calendar update.
Thank you, Mr. Chairman. I'd like to briefly review the calendar with you for the months of October and November. And this Wednesday and Thursday, the 5th and 6th, from 9 a.m. until 2 p.m., the Ag 'em Up Day will be held at the Bladen County Park, and it looks like the weather will be good, so that's a good thing. This Saturday, the 8th, from 4 until 7 p.m., there's a barbecue. This depends on the weather. It is scheduled to have a barbecue plate sale at the historical building in Bladenboro, and proceeds will benefit Southeastern Carolina Crossroads. Also that day, at the Elizabethtown Armory, there is a car and truck show fundraiser to benefit a baby J.T. Higgs, and so just to let you know about that as well. On Wednesday the 12th and Thursday the 13th, I don't think the Ag 'em Up Day rain dates are going to be necessary. The evening of the 13th at 6 p.m., Bladen Community College Foundation will have its annual Seafood and Sunset event at Camp Clearwater. Also that evening at 7 p.m., the Bladen Fire Association meeting will be held at the Bladenboro Fire Department. On Saturday the 15th at 9 a.m., the United Way's 5K Crazy Color Run and Walk will be held at the Industrial Park in Washington. The Board of Commissioners meets on Monday the 17th at 6:30 p.m. On Thursday the 20th at 6 p.m., the Lumber River Council of Governments annual meeting will be held at the Southeastern Agricultural Center in Lumberton. On Friday the 28th, there's a Carolina Caledonian Festival at Lee Mill Vineyard, and that also continues through Saturday and Sunday. On Friday night at 6 o'clock, the Bladenboro Beast Fest opens, and it continues on Saturday the 29th. Moving over to November, on Thursday the 3rd at 6 p.m., the Southeastern Partnership annual meeting will be held at Cape Fear Vineyard and Winery. On Monday the 7th at 8 a.m. there's a prayer service here, and the Board of Commissioners meets that evening at 6:30 p.m. On Thursday the 10th at 7 p.m. the Bladen Fire Association meeting will be held at the Carvers Creek Fire Department. Offices will be closed on Friday the 11th in observance of the Veterans Day holiday. The Board of Commissioners meets on Monday the 21st at 6:30 p.m. and offices will be closed on Thursday the 24th and Friday the 25th in observance of the Thanksgiving holiday.
Greg, are they gonna have a Veterans Day celebration? Have you heard anything yet?
I'm sure they will. I have not heard anything yet, but
All right, motion to
I
adjourn.
think they would.
Let's do adjourn.
Second by Mr. Dallas. Everybody in favor, aye?